All right, I'm ready. I think I know them. Go ahead.
Iliac crest.
Okay. A crest is a ridge of bone. So here is the left iliac crest. Okay. And then I can come over and show you the right. Okay. Next.
Interior superior iliac spine.
Okay. In anatomy, a spine is a ridge of bone or a projection. So if I follow the iliac crest anteriorly, I'm going to find a little projection. That is the anterior superior iliac spine.
Wow.
Okay? If I go posterior, that is the posterior superior iliac spine. Okay? So the iliac crest is an important landmark. Next.
Okay. The greater trochanter.
Okay, the greater trochanter.
Canter.
A trochanter is another name for a projection. And this is the femur bone. And it's this entire large landmark. Okay? You could feel it on the outside of your hip. Down a little bit. Okay? So I'm on the right greater trochanter. Next.
The pubic symphysis.
Okay, the pubic symphysis is a joint. So the right pubic bone, left pubic bone with the cartilage. On the model it's plastic. So this is the pubic symphysis. Yeah?
Medial epicondyle of the femur.
Okay. So if I follow the shaft of the femur down distally, there's two enlarged processes. The very lateral and very medial part of these condyles are the epicondyles, okay? And I can confirm that I'm on them, just like I did with the epicondyles in the upper extremity, by bending and straightening the knee. If I go too far down and I bend and straighten the knee, my fingers move. So now I know I went too far, okay? All right, next.
The lateral epicondyle.
Okay, so lateral, medial. Okay.
Patella.
The circular, known as the kneecap. All right, we're going to be careful when we palpate each other's patellas. We don't want to put downward pressure. Okay, next.
Head of the fibula.
So the outside bone is the fibula. Head. Lateral malleolus. Okay. The inside larger bone is the tibia. And there's a prominence on the front of the tibia. Sometimes you can actually see it, sometimes you cannot. That is the tibial tuberosity. I'm going to slide down the crest or shin bone. And then the enlarged medial projection is the medial malleolus, lateral, medial, okay? And then I think the only other landmark would be the heel bone or calcaneus. Did I hit them all, Lise?
You did.
All right, so now we're going to turn around. Posterior view, crest, posterior, superior iliac spine, okay? In between the posterior, superior iliac spine is the sacrum. Those are the 5 fused vertebrae. And then I can end up with the tailbone or coccyx. All right? And then from the back view, you can see the greater trochanters, the condyles of the femur. Ischial tuberosity is what you sit on. If you're on a hard surface, it makes you want to move. So ischial tuberosity. And I believe I hit them all from the front. We have the medial epicondyle, lateral, head of the fibula, medial and lateral malleolus, medial, lateral, and then again the heel bone, or calcaneus. Okay? All right, I'm going to give you 5 minutes to find those landmarks. Try not to look on a skeleton, okay?